This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. There's a shortage of reproductive medical professionals in Connecticut, leading to wait times for some health services in our state, including in-clinic abortions. But Connecticut's Safe Harbor Law, signed by Governor Lamont in May, will soon allow for advanced practice clinicians, like nurse midwives and physician assistants, to perform first trimester abortions. The change is likely to lessen what is now a 2-week wait. Today, Where We Live, we hear from Amanda Skinner, a nurse midwife and CEO and president of Planned Parenthood of Southern New England. And coming up later, a local advanced practice nurse and longtime member of the advocacy group Clinicians in Abortion Care also joins us. Now, what questions do you have? You can join us too, 888-720-9677. That's 888-720-WNPR. Share a comment on our Facebook page or find us on Twitter at Where We Live. Joining us first on Zoom, Amanda Skinner, President and CEO of Planned Parenthood of Southern New England, serves Connecticut and Rhode Island. Amanda, welcome to the show.
Good morning, Lucy. Thank you for having me.
Now, in February, Hearst, Connecticut reported that Planned Parenthood of Southern New England had to cancel a third of its abortion clinics around the state because it did not have enough physicians available. Again, that was in February. So tell us where the shortage stands now.
That's right. In February, we did have to cancel about 1/3 of our abortion clinics. And when we talk about abortion clinics, what we're talking about are the times that we have established to be able to provide abortion care in our health centers, specifically procedural in-clinic abortions. Unfortunately, we are still at about a 2-week wait time for in-clinic abortion appointments. And when somebody is looking to have an abortion procedure, a 2-week wait time is a really long wait, and this is just not equitable or just for our patients.
Now, when we talk about abortion care, I was wondering if you could maybe drill down a little bit more for us in terms of when we talk about in-clinic or aspiration abortions. And then there's also medication abortion, which I understand makes up a majority of abortions in our country. And so can you tell us more?
That's right. So there are different types of procedures that a patient could have when they're seeking abortion care. As you noted, medication abortion is the most common type of procedure now. Just going backwards a little bit, over 90% of abortions occur in the first trimester of pregnancy. Medication abortion is used in the first trimester, and it utilizes 2 medications, mifepristone and misoprostol. And that is an approach that can be used up to 11 weeks after the first day of the last period. So that's considered 11 weeks pregnant. Mifepristone blocks the body's own progesterone, which stops the pregnancy from growing. And then the second medicine, misoprostol, can be taken either right away or up to 48 hours later. And this medicine causes some cramping and bleeding to empty the uterus. This is sort of like having a heavy, crampy period. And the process that the patient experiences would be similar to an early miscarriage. Then there are also, as you noted, in-clinic abortion procedures. The most common of the in-clinic abortion procedures is aspiration abortion, which is using a gentle suction procedure to empty the uterus. It's quite a simple procedure, and it's usually used up to about 14 to 16 weeks after the last period. But again, the vast majority of these occur in the first trimester.
And when we talk about Planned Parenthood health centers in Connecticut, are all of them, how many are there, and can all of them provide medication abortion? Then how many can provide the in-clinic abortion, Amanda?
Right. So at Planned Parenthood of Southern New England, our service area covers Connecticut and Rhode Island. And across the 2 states, we have 15 health centers. 14 of those health centers are in Connecticut. And we have a Planned Parenthood health center within about 30 minutes of most of the people, well over 90% of the people in Connecticut. Of our 14 health centers, 4 of those health centers provide in-clinic or procedural abortions. The other 10 and those 4 all provide access to medication abortion.
Now, part of the reason we invited you on the show today is to talk about this new state law that also, as part of it, it's been called the Safe Harbor Law, will help train and expand the number of medical professionals in our state who can provide abortion care. And so can we talk about that in terms of before the law, who was able to provide in-clinic abortions, and now in terms of when the training will be done to help expand access, Amanda?
So we are very proud in Connecticut that we had forward-thinking legislators 32 years ago who codified the tenets of Roe versus Wade into state law in Connecticut, protecting access to abortion care in Connecticut. That was, very sort of ahead of its time thinking at the time, and we had incredible champions who did that. But the law reflected the understanding of abortion procedures at the time, and really contemplated only procedural abortions and had language in the law that was specific to physicians. So the way we thought of it was that it was a physician-only law. Now, once medication abortion became an alternative, we had an attorney general's opinion that evaluated the law in Connecticut and made clear that the existing law in Connecticut really only spoke to procedural in-clinic abortion. So once we had that attorney general's opinion in Connecticut, advanced practice clinicians have been able to provide medication abortion. But until the passage of the Reproductive Freedom Defense Act, which was passed in the spring but went into effect on July 1st, only physicians could do the in-clinic or procedural abortions. Now, advanced practice clinicians, nurse midwives, advanced practice nurses, and physician assistants are also able to provide in-clinic first trimester aspiration abortions.
Now, I understand that there is going to be training by Planned Parenthood for these healthcare professionals. Can you tell us about that? And when that training is complete, do you anticipate all of your clinics will be equipped to also perform aspiration abortions?
Well, the first thing I want to say is that the safety of our patients is always our top priority. And we know that abortion is one of the safest medical procedures you can have. It's safer than a colonoscopy. So when we think about our training program, the top most important thing, most paramount thing for us is ensuring the safety of our patients and the quality of the care that we provide to our patients. So we're starting our first cohort of training this summer, and it's intentionally small with one nurse midwife and one advanced practice nurse who are going to go through the training. The training procedure includes both didactic and simulation training. It includes education, and then each trainee will do one procedure day per week with the aim to get them through 30 to 40 observed procedures where they have direct oversight from the physician who is training them. Our chief medical officer at Planned Parenthood of Southern New England is Dr. Nancy Stanwood. Dr. Stanwood has decades of experience in creating and leading training programs for healthcare professionals. Specifically, she came to us from Yale Medicine, where she ran the family planning residency program. And she is modeling our training program on a training program from the University of California at San Francisco's institute called the Advanced New Standards in Reproductive Health. They did a 2013 study, and they developed a model called the TEACH training program. And that training program demonstrated very clearly over 11,000 procedures that were evaluated that advanced practice clinicians can perform aspiration abortion procedures just as safely as physicians can. The other thing I want to note about training is that the way healthcare professionals learn new skills is through training. So, for example, I'm a nurse midwife, and I was trained both in my academic environment, but also once I was in clinical practice in new procedures. There were procedures that became customary in practice after I had completed my actual academic environment, and we were trained once we were actually in clinical practice. There are advanced practice clinicians who receive post-academic training in IUD insertion. And if you can do an IUD insertion, you can be trained in first trimester aspiration abortion. It is a very similar in terms of its complexity or lack of complexity, very similar procedure.
You're hearing Amanda Skinner here on Where We Live, President and CEO of Planned Parenthood of Southern New England, as we talk about Connecticut's new law that went into effect July 1st. As part of it, expands the number of clinicians who can provide in-clinic abortions in our state. Amanda, we started the conversation talking about the 2-week wait. So do you anticipate that with these additional professionals trained, that wait will decrease? And then we've also got this other part that is harder to, I guess, pin down, the number of out-of-state residents who may be coming to Connecticut after the Dobbs decision.
So first of all, we absolutely do anticipate that the week will come down, the 2-week wait will come down as we're able to train additional clinicians. We are facing not only our own 2-week wait, but in fact, fewer and fewer OBGYNs are being trained in abortion provision. A study from 10 years ago, and this has changed since then, showed that while 97% of OBGYNs encounter patients who seek abortion care, at that time, only 14% of OBGYNs provided abortion care. And we anticipate that now, as we see abortion banned across the country, the shortage will only get worse because there are going to be fewer training programs for OBGYNs. So it's a critical step to be able to train medical professionals, because I want to really underscore that advanced practice clinicians are healthcare professionals who are highly trained and skilled within their own scope of practice. To be able to provide this first trimester aspiration abortion procedure is going to expand access. And when we thought about the Reproductive Freedom Defense Act and the need to do this right now, it was really in anticipation of this time where we knew that additional patients were going to need to seek care in states where abortion access was protected.
You can join our conversation, 888-720-9677, or find us on Facebook and Twitter at Where We Live, when we talk about the scope of practice within a given provider's expertise. When we think about Connecticut's law now expanding the ability for, again, certified nurse midwives, physician assistants, advanced practice, registered nurses. Other states had already done this. Can you tell us a little bit more about that?
Absolutely, yes. There were, I think, 14 other states that had already expanded practice for or included in their laws that advanced practice clinicians could provide first trimester aspiration abortion. And as we worked through the process in Connecticut, we did a number of things. First, we got an opinion from the State Department of Public Health to confirm that within our state laws governing the practice of advanced practice clinicians, and they each have their own statutes in Connecticut, that it was clear that first trimester aspiration abortion was within their scope of practice. So I want to be clear that this was not an expansion of scope of practice. This was actually a reflection of an appropriate procedure that they were prevented from being able to do based on an outdated law, and not an expansion of their scope of practice, just inclusion of a procedure that's well within their scope of practice. One of the things that we found as we went through this process was, sort of an expression of concern, talking about quote unquote mid-level clinicians. And the phrase mid-level clinician is demeaning, and it suggests a lower standard of care from advanced practice clinicians. And that's simply not true. Advanced practice clinicians are highly qualified, they're highly trained medical professionals, and there's extensive research demonstrating the safety and quality of care that's provided by advanced practice clinicians.
You mentioned that concern. Where did that come from, Amanda?
I think, honestly, what we're facing right now across the country, and even here in Connecticut, in a state where abortion access is protected, is desires to find additional ways to reduce access to care. And fundamentally, these laws, whether they're an abortion ban that bans abortion or an abortion ban that prevents a qualified clinician from being able to provide a particular type of abortion procedure, that these bans are really about being part of a larger agenda to control people's bodies, lives, and futures, to be able to constrict access to healthcare that people deserve. And so I really think that in this particular case, this was not, it was more red herring. It was not an actual concern because the research is so clear about the quality of care, both broadly from advanced practice clinicians and very specifically around the provision of advanced aspiration abortion procedures. I think it was just another way to try to constrain access for patients.
I understand you've been president and CEO of Planned Parenthood of Southern New England for, I believe, more than 5 years. You mentioned earlier that you're a nurse midwife, but when we talk about a nursing model of care, maybe talk more about why that's such a critical piece of this conversation when we talk about expanding access to abortion care.
I am a nurse midwife. I was privileged to work as a nurse midwife in comprehensive healthcare in Connecticut for 10 years and care for thousands of patients. And one of the things that I love most about the nursing model of care, one of the reasons I chose midwifery as the path for me when I decided to become a healthcare professional, was because the nursing model of care is holistic. It recognizes the whole person. It contemplates not just the person's physical well-being, not just their mental well-being, but their social and emotional well-being, the social systems that they operate in. It really recognizes that people bring their whole lives with them into healthcare and contemplates how we can help support a person through whatever healthcare experience they're having, and consider all of those factors about them, that they are not merely a patient in the eyes of a nurse, but a person, and a person with an entire life around them. And that is absolutely critical when we think about access to abortion care, particularly when we think about all of the factors that folks face in being, in facing challenges in access to healthcare, right? We know that the healthcare system is laden with implicit bias and racism. We know that folks who are of lower incomes, who live in rural communities, really struggle to access care. People who may not have childcare or transportation, paid time off of work. These are all factors that are not exclusively medical, but do affect a whole person. And that holistic model is so critical to nursing and central to nursing, and I think central to being able to provide comprehensive sexual and reproductive health care, including abortion care.
My guest today is Amanda Skinner, President and CEO of Planned Parenthood of Southern New England. We'll continue talking after the break, including more about how local providers will help out-of-state patients who may come to Connecticut seeking abortion care. You can join us too, 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. You're listening to Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. On July 1st, Connecticut's law expanding protections for the right to an abortion went into effect. We've been learning about how the law permits healthcare professionals like certified nurse midwives, advanced practice registered nurses, and physician assistants to be trained to administer first trimester in-clinic or aspiration abortions. Now, the measure also protects patients coming to Connecticut from states with restrictive abortion laws, and it protects local abortion providers from lawsuits filed in other states. Planned Parenthood of Southern New England told the Connecticut Health Investigative Team, or CHIT, back in June that local clinics have already seen a number of people traveling from Texas since Texas banned abortion after 6 weeks of pregnancy. With me on Zoom is Amanda Skinner, President and CEO of Planned Parenthood of Southern New England, which serves Connecticut and Rhode Island. You can join us, too, with your question or comment, 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter @Where We Live. Amanda, I'm curious what your clinicians in our region are seeing now in the wake of the Dobbs decision when it comes to out-of-state patients.
Well, we didn't even have to wait for Dobbs, unfortunately, because in September of 2021, Texas's law, SB 8, went into effect as one of the most extreme abortion bans in the country. That law prohibited abortion after 6 weeks in Texas. And so over the past, 9 or 10 months or so, we've seen about a dozen patients traveling to Connecticut from Texas for abortion care. And, I just would love for people to contemplate for a moment the incredible difficulty and burden that is placed on a patient to travel thousands of miles to receive healthcare. And as I said earlier, so often the patients who are most harmed by these bans are people who struggle to access basic preventive healthcare already. Communities of color, people of low incomes, people living in rural communities, members of the LGBTQ plus community, specifically trans and non-binary people. So as we think about who these bans really harm, that's who they harm. Now, when we think about, our experience over the last 12 months or 10 months or so, with only about a dozen patients from Texas, of course, in the wake of the Dobbs decision, we anticipate that 26 states across the country are going to enact abortion bans. And those bans are going to cover such a large geography of the country. Upwards of 40 million people of reproductive age who could conceive or carry a pregnancy are going to no longer have access to abortion in their own communities. And that means we're going to see more and more people having to travel to receive this kind of care. What I can say about our own clinicians at Planned Parenthood of Southern New England is that they are galvanized. They are proud to provide comprehensive sexual and reproductive health care to our patients, including abortion care. And they are ready to be there for every patient who needs us, no matter what.
When we talk about the patient population that Planned Parenthood serves, so you're saying 8 out of 10 of those patients are people living at or below the federal poverty line. A majority are people of color and who struggle to access care, Amanda?
That's absolutely true. 85% of our patients live at or below 250% of the federal poverty level. But again, the federal poverty level is so egregiously low that 250% of the federal poverty level is also an experience of living that is decidedly low income and challenging for folks. A large majority of our patients, about 59% of our patients, are people of color. And what people know about Planned Parenthood is that they will come to us and receive non-judgmental, comprehensive care where they will be considered a whole person when they walk through the door, from healthcare providers who know them, healthcare professionals who they trust. Those are our advanced practice clinicians. And, in an environment where there's no judgment, just care.
And when we talk about abortion care for those who may come to our state seeking abortion care, can you talk about the calculus that your clinicians are under in terms of making sure that they spend enough time here for any post-recovery? And, the challenges when we think about some of those states, those restrictive abortion laws, where people are coming from.
Right. I mean, the fall of Roe has ushered in unprecedented circumstances in the United States. The legal and policy environment right now is chaotic, and really, all bets are off, and it remains to be seen what laws are going to be passed in each state. We've seen some of the restrictions that are being passed and enacted, but this is really just the beginning. And so we can't say for certain what these varying laws across 26 different states, where there will probably be multiple, not just bans in their states, but multiple other restrictions passed, what those will definitely mean for patients or providers. It's just hard to say right now in this very uncertain environment. What we do know is that the protections in the Reproductive Freedom Defense Act, which included the expansion to include advanced practice clinicians, but also included some protections for patients who seek abortion care in Connecticut and for providers who provide abortion care in Connecticut to patients from out of state, are a starting point to ensuring that abortion remains safe and accessible here in our state. As of right now, no state has actually attempted to enforce restrictions on abortion outside of its own borders, and no state has passed legislation that would explicitly allow that kind of cross-border enforcement. But while that has not happened yet, that doesn't mean that won't happen. And I think, we are going to see those kinds of efforts. And it will be crucial for us to evaluate each law state by state to ensure that we are protecting those patients who come to us and our clinicians as they're providing care to those patients.
I believe the state of Missouri is contemplating a bill that would limit interstate travel. And so that's what you're talking about, Amanda.
That is what I'm talking about, yes.
And when we think about abortion care, I know on the show in the past we've talked about funds to help pay for travel. But also when we think about, I had mentioned post-recovery and lodging and like all of the other things that people may not be thinking about just when someone makes an appointment in our state. I'm wondering if you can talk more about that.
Sure. We have, again, already experienced this with patients coming from Texas. And at Planned Parenthood, we had been planning for this. We had been anticipating, that there were at least good chances that Roe versus Wade would be overturned. And we had the experience from Texas to ensure that we were developing and building systems to support patients, working in partnership with all of the other entities within the abortion access and sort of sexual and reproductive health and rights movement partners, reproductive justice organizations, independent abortion funds, independent abortion providers like Planned Parenthood. What's really critical right now is that we are working in partnership with each other to provide the most seamless and well-supported experience for patients. Because you're absolutely right. If you are traveling thousands of miles for a healthcare procedure, you have to contemplate childcare for the children that you have, because the majority of people who have abortion procedures or seek abortion care already have children. You have to contemplate how you're going to get time away from work. You have to think about what kinds of travel you're going to be able to access. Are you going to travel by car? Are you going to need to fly somewhere? Do you have access to those? Do you have the financial means to resource those? And if you don't, where can you access those resources? Independent abortion funds are a really great, important resource for that for folks. And then once you get to the place where you're going to have your abortion, then you need to be able to receive that care safely, recover, likely complete your abortion procedure before you return back to a state where there is a ban. Again, with the legal environment being so chaotic, it's going to have to be evaluated sort of law by law, state by state, to ensure that we are from a procedural sort of process perspective, working with those patients to ensure that we are protecting their safety, not just medically, but also from the laws in their states that might criminalize them simply for accessing healthcare.
Coming up in just a few minutes, we'll be talking more about, again, Connecticut's efforts to expand access to abortion care, including talking to medical professionals who will be trained, again, to provide in-clinic aspiration or in-clinic abortions in that first trimester. But I have to ask, Amanda, we've been talking a lot about this law in Connecticut that provides protections, also expanding access. But when you think about the people who are marginalized, the patients that Planned Parenthood serves, what more the state can do to make sure that they have access to care? I'm thinking of people regardless of their immigration status.
Absolutely. Absolutely. So, we know that there are terrible disparities in healthcare. And one of the most significant disparities is in access to insurance. So we would love to see an expansion of Husky for people in Connecticut, regardless of their immigration status, because we want all people to access the healthcare that they need and deserve, including basic preventive healthcare. And we know that, a healthy community, healthy members of the community are productive members of the community, engaged members of the community, that keeping people healthy and well is good for all of us, right? The other thing I really want to make sure to note when we think about the disparities in healthcare and the communities that are impacted by these bans and where we could focus additional energies is, for example, when we think about the racial disparities in maternal fetal health. So again, the majority of our patient population are people of color. In 2020, the Centers for Disease Control reported that the maternal mortality rate for non-Hispanic Black women was nearly 3 times the rate for non-Hispanic white women in the United States. And when we think about the impact of abortion bans, the University of Colorado at Boulder did a study and showed that banning abortion nationwide could lead to a 33% increase in pregnancy-related deaths among Black women compared to prior rates. So those prior rates were already shameful, and then those could go up by 33% among Black women if abortion was banned nationwide. So we also need to be really leaning into addressing barriers to all healthcare services, comprehensive prenatal care, access to doulas, comprehensive, unfettered access to and education about contraception, about people having the information they need to make the best choices for their own lives, for their own bodies and futures. And then again, taking down those barriers that people face to care. Even here in Connecticut, it's not just insurance coverage. It's also having sufficient paid time off of work. It's also having really excellent access to transportation to healthcare and physical access to healthcare. One of the reasons that we continue to maintain so many health centers in our communities at Planned Parenthood of Southern New England is because we know that even in a world of telehealth, physical access to your healthcare provider, having them within a accessible physical space to you is so critical for people being able to get the care that they need.
Again, you're hearing Amanda Skinner here on Where We Live, President and CEO of Planned Parenthood of Southern New England. After a short break, we're going to hear from one of the reproductive health professionals in Connecticut who will be able to perform in-clinic abortions with this change in state law. You can join us too, 888-720-9677. That's 888-720-WNPR, or share a comment on Facebook. Find us on Twitter at Where We Live. This is Where We Live on Connecticut Public Radio. I'm Lucy Nalpathanchel. Today we've been talking about Connecticut's law that protects a patient's right to abortion care in our state, including expanding access by training more healthcare professionals to administer in-clinic first trimester abortions. These professionals include advanced practice registered nurses, physician assistants, and nurse midwives. Joining us now on Zoom is Loren Fields, an APRN at Planned Parenthood, also a lecturer in nursing at Yale School of Nursing. Loren, welcome to our show.
Thank you.
And what does this change mean for you and your patients?
This change carries a lot of meaning for me and the people that I take care of. My journey towards becoming a nurse practitioner now started about 15 years ago. And pretty much as soon as I decided to enter this profession, I had a vision of my practice that meant that I would be there and I would be ready to take care of as many needs as possible for the people that I took care of. And that included abortion care and miscarriage management and aspects of their primary care. And so as a nursing student, I sought out many educational experiences. I attended conferences. I got advanced training, really with this vision of a very holistic practice where I could offer patients their options when they had early pregnancies or early pregnancy complications, and I would be there and prepared to offer them the care that they needed. And because I chose to build my practice in the state of Connecticut, where we had a physician-only law, for the last 15 years or so of my career, I've not been able to provide aspiration abortion. I've had to refer patients to other providers, other clinics when they need that service. And so this change in the law makes it possible now that there could be a future where I could take care of those patients myself with the advanced training that I have and with the relationships that I already have with them.
Mm. So earlier when we talked about scope of care or what falls within a provider's expertise to offer a patient, as you've outlined, this was really important that you would be able to provide procedural abortions in the services you provide your patients.
Yes, absolutely. I know that relationships, trust, are essential to high quality healthcare. And I've also spent my whole career working at Planned Parenthood, as Amanda has outlined. We take care of a lot of folks who have issues accessing healthcare. And so to be able to not have to send patients away to a different clinic or a different provider to give them the care that they need is huge for their ability to access quality health care.
I understand you testified in support of this portion of Connecticut's Safe Harbor, now a law. Tell us about that testimony, why it was important to you based on your advocacy work in the past.
Sure. So back in 2009, as a eager nursing student, I attended my first National Abortion Federation meeting, and I connected with a community there that's now called Clinicians in Abortion Care. But it was a group of advanced practice clinicians, nurse practitioners, nurse midwives, physicians, assistants who were really passionate about having abortion be included in the scope of practice of advanced practice clinicians. And so that community was an important home for me for about a decade. I was a leader in their advisory committee for about 6 years. And so I had really spent the last decade learning a lot about scope of practice as it relates to abortion care, the mechanisms for advancing legal change. And so when the call came forward this spring for clinicians to testify about what a legal change like this could mean, I felt well prepared to speak to that.
Amanda Skinner is still with us again, President and CEO of Planned Parenthood of Southern New England. So when we hear from medical professionals like Loren about the importance of the care that they provide their patients, I'm wondering if you can talk more about that when we think about the clinicians at Planned Parenthood who are the primary care providers for these patients.
That's absolutely right. And we know that at Planned Parenthood of Southern New England, our advanced practice clinicians are the providers who know their patients best. They're the people our patients see for their well exams, for STI testing and treatment, for vaccines. For our patients, they are their trusted frontline providers of healthcare. And so when we think about like what is high quality healthcare, high quality healthcare is patient centered. Well, seeing a provider that you know and trust when you're the patient is patient centered. High quality healthcare is timely. It's care that people get when they need it. Well, expanding practice, expanding the ability for our advanced practice clinicians to be able to provide this procedure means that we will be able to provide more timely care. It's safe and effective. Well, we already know that that's true of aspiration abortion procedures, right? Again, because the research shows it so clearly. So fundamentally, for me, this is about quality of care and the experience that our patients have, being able to see the healthcare provider that they know and trust for the care that they need when they need it in a safe, high quality way.
Loren, when we think about the moment that our country is in, I'm just wondering, personally, what this means for you that you'll be able to also provide this care within your practice.
Well, this possibility really opens up for me, as I was sharing a bit ago, a fuller coming to light what my original vision for my practice as a nurse practitioner was, which was to be able to offer as comprehensive of gynecologic and sexual and primary care to the people that I take care of as possible. And so this change brings me closer to that vision that I had for my practice.
Earlier, Amanda was outlining, depending on the state a person lives, the resistance to expanding access, whether there be concern about what type of medical professional can provide this care. How do you respond to that, given your expertise?
Well, I really appreciate what Amanda said about not thinking about this like an expansion of scope of practice, but rather looking at this as giving legal support to an aspect of care that there has been widespread agreement from the medical and nursing perspective for a long time that this is appropriate care for advanced practice clinicians to provide. And if you look at the history of our professional societies, the organizations that represent our profession, you can go back to the 1990s, actually, and see statements from leading professional societies, including the American College of Nurse Midwives, the American College of Obstetricians and Gynecologists, saying that not only do we think that this is in the appropriate scope of practice of these clinicians, we actually believe it will help resolve part of an existing public health crisis that we had. Because, of course, even prior to the most recent events, we have had access issues to abortion care existing long before this year.
Thank you. Again, that's Loren Fields, an APRN at Planned Parenthood and a lecturer in nursing at Yale School of Nursing. Before we run out of time, Amanda Skinner, I wanted to go back to you. You had mentioned briefly telehealth, and I'm wondering about telehealth and abortion care from Planned Parenthood's perspective, especially for patients who can't travel to Connecticut based on different laws. Can you tell us more?
Well, there are a lot of nuances in the laws of telehealth, particularly as it relates to medication abortion via telehealth. Broadly speaking, telehealth is an incredible tool in our toolbox to expand access to healthcare. And we've learned so much about ensuring high quality patient-centered telehealth throughout the pandemic. And I think that's been a real transformation in healthcare more broadly, not just at Planned Parenthood, but really in the whole healthcare delivery system. Now, that being said, as I mentioned earlier, the laws in states are changing rapidly. Telehealth is, broadly speaking, governed by state law. And for a clinician to be able to provide care to a person in another state, the clinician has to be licensed in that state and abide by the laws in that state. So if abortion is banned in a particular state, without dissecting every single state's laws, it is most likely that telemedicine abortion will be banned in that state if the patient is physically in that state. Now, of course, there are, I'm not a legal scholar, but there are a lot of brilliant thinkers thinking about how we can maximize the power of telehealth to expand access to care for folks as it relates to medication abortion. And certainly here in Connecticut, we are working with with the administration and with our legislators to ensure that we have as much clarity as possible about our own ability to provide telemedicine abortion in Connecticut. That is something we are still working on. And in the meantime, we are using care and telemedicine to reach our patients for other sexual and reproductive health care, things like pre-exposure prophylaxis, for prevention of HIV, for urinary tract infections, for medication abortion follow-up visits, for prescription refills, and for some gender-affirming care. So we are maximizing the way that we can use telehealth now and have built really good systems. But currently, we are still working with the state to ensure that that telemedicine is an alternative for medication abortion.
So all hour we've been talking about Connecticut's law, but meanwhile we know that federal efforts to protect abortion care are stalled, including the Freedom to Travel for Healthcare Act. Amanda, just with a couple of minutes left, why this is so important to be approved by Congress.
Oh, well, it's incredibly important because of exactly what we've been talking about today. The Supreme Court decision in Dobbs essentially stripped away a fundamental right, the first time in history that the Supreme Court has taken away a right it previously granted, and put the decision-making about people's healthcare and bodies, lives, and futures in the hands of state legislators and state politicians. And so, as we talked about, while it hasn't happened yet, it is very possible that states where they ban abortion will endeavor to enact laws that would also ban cross-state travel. So a federal law protecting people, saying that people can travel to other states for care that is legal in those states, that their state of residence does not prevent them from being able to access care where it is legal, is absolutely crucial. It's appalling enough that somebody's zip code is going to determine whether or not they deserve or are able to access care in that zip code. It's even more appalling to think that it would prevent them from accessing care in other states where that care is legal. So it's absolutely crucial. And I would say, the same is true for the Women's Health Protection Act, which would codify the tenets of Roe into federal law, protecting abortion access across the country. Because what we really want is people to be able to make their own decisions about their bodies and have access to the care that they need in their own communities.
Again, that's Amanda Skinner, President and CEO of Planned Parenthood of Southern New England. We appreciate your time with us today on the show, Amanda.
Thank you. It was a pleasure to be with you today.
And also thanks to Loren Fields, an APRN at Planned Parenthood and a lecturer in nursing at Yale School of Nursing. I'm Lucy Nalpathanchel. Today's show produced by Katie Pellico. Our technical director is Kat Pastor. Coming up tomorrow, more about telemedicine, including visits surging when the pandemic began. And now doctors across Connecticut say many of those patients have opted to stay with televisits. We'll find out more tomorrow.